Bismillah ar-Rahman ar-Rahim. In this video, we will demonstrate the direct technique for fabricating a custom-made cast post and core. For the aim of demonstration, we will use an endo-treated maxillary premolar which was cut leaving only 2 mm to mimic a damaged tooth. Armamentarium for coronal tooth structure preparation, high-speed handpiece, mouth mirror, explorer, and diamonds. Armamentarium for post-space preparation, low-speed handpiece, gates glidden size 2 and 3, piezo reamers size 2 and 3, normal saline, paper points, tweezer, and endodontic K-file. Armamentarium for resin pattern fabrication, petrolatum jelly, micro brush, spatula, medicine dropper, dampen dish, resin pattern monomer and polymer, syringe with 18 gauge tip, speedy post, and brush. First, coronal tooth structure preparation. Using a round and tapered diamond, prepare the remaining tooth structure as if the crown is intact, ignoring the missing coronal tissue, meeting the same principles of tooth preparation. Remove all internal and external undercuts that will prevent withdrawal of the pattern. Any unsupported tooth structure is removed as well. Be sure that part of the remaining coronal tissue is prepared perpendicular to the post. This will create a positive stop to minimize wedging and subsequent splitting of the tooth. Make sure to have at least 2 mm of the coronal tooth structure above the finish line to gain a restoration with a ferrule. Second, post-space preparation. In case of multiple canals like this tooth, we use the slope rule in order to determine on the radiograph which canal is the buccal and which is palatal. The radiograph is taken with a mesial or distal angulation. The canal, which appears in the same direction as the cone, will be the palatal canal, and the one moving in the opposite direction will be the buccal canal. We choose the straightest and the largest canal, which is the buccal in this case. Determining the length of the post. The post length should be 2/3 the length of the root canal. It is also very important to leave at least 4 mm of gutta-perca apically to maintain the apical seal. A gates glidden is measured against the radiograph to determine the length to which the gates glidden and reamers will be inserted into the canal. Adjust the stopper to a determined reference point coronally. Use this measurement as a guide for gutta-perca removal. Gutta-perca is now removed using size 2 gates glidden to the determined length, followed by size 3. The canal is shaped using piezo reamers size 2, followed by size 3 if needed. With a K-file, clean the walls of the canal to eliminate any remaining gutta-perca, sealer, and undercuts to gain smooth walls which will facilitate building the post later on. Irrigate the canal well by normal saline and dry it using large-size paper points. Another radiograph is taken to evaluate the post space preparation before proceeding with pattern fabrication. Third, resin pattern fabrication. Post pattern fabrication. The canal is lubricated with petrolatum jelly using an endophile and a small brush. Care must be taken to remove any excess of petrolatum jelly before proceeding with pattern fabrication. In a dampened dish, acrylic resin, monomer and polymer are mixed to a runny consistency and applied in the syringe. The prepared canal is filled with acrylic resin. The speedy plastic post is coated with monomer and seated completely in the canal. After about 2 minutes, when the acrylic resin becomes tough and dewy, the pattern is pumped in and out to ensure that it will not lock into any undercuts in the canal. As the resin polymerized, the post is removed from the canal with care taken to ensure that it extends to the apical end of the prepared canal, and it is free of any voids or defects. The post is reinserted into the canal and moved up and down again to make sure it can be withdrawn easily at a later time. Core pattern fabrication. To build the core, add resin by dipping a small brush in monomer and then into the polymer. Lightly overbuild the core and let it polymerize fully. Cut the excess of the post and shape the core with the large round end tapered diamond. Use water spray to prevent overheating of the resin. Apply all the principles of tooth preparation, axial reduction, and occlusal reduction. There should be no roughness or undercuts. Any acrylic resin covers the tooth structure should be removed. It is desirable to complete reduction and contouring in resin because it is difficult and time-consuming to shape the metal after the core has been cast. Remove the pattern, sprue, and invest it immediately.